Welcome back. South Africa is one of the countries set to receive the Covax COVID-19 vaccine. It still remains unclear when the vaccine will be available in the country. Is the government doing enough to communicate about the vaccine? Professor Barry Schoub, chairman of the Ministerial Advisory Committee on COVID-19, joins us now. Professor, thank you very much for your time. So, firstly, tell us, apologies, how is this vaccine going to be procured and distributed through the Covax program?
Yes, thanks, Annie. Well, the Covax program is really kind of earmarked or goal for about 10% of the population. And then there is, in addition to that, a initiative from the private and government sector to purchase additional by negotiating bilaterally with vaccine manufacturers. So the first vaccines which will arrive in the country from either source will go to the high priority groups. The high priority groups are those individuals who are either most vulnerable to getting infected, and of course these are the frontline healthcare workers, or those who are most vulnerable to the complications, the severe infection. So those are the elderly, particularly those in nursing homes and care homes. So that's really the kind of highest priority for selective immunization. That'll be the first tranche of vaccine which comes into the country.
So that's quite important to specify, Professor, because I think a lot of people who are reading articles and talking about the vaccine could be under the misconception that when we talk about 10% of our population getting vaccinated, that they think that that's the totality of the people that would get the vaccine. But you're saying that there would be ongoing batches to arrive. Am I correct?
Yes, absolutely. There will be kind of batches coming in tranches. We've actually grouped them into Group A, Group B, and Group C. Group A, the highest priority level. Group B are the lesser priority, and then Group C is for the entire, what we call universal immunization. So obviously the first tranches will go for the highest priority, and then the Group B, the second, and then after universal. And obviously we're all hoping that the vaccine will come as soon as possible. That's obviously everybody's hope.
When we say as soon as possible, there are various time periods being bandied about. Some people say, well, up to 6 months. Others say the end of the first quarter. But that still means that we're about 3 to 4 months behind countries who are vaccinating now already. Why is there that delay for South Africa?
Well, you see what happened with many of the, particularly the high-income countries, that they pre-purchased vaccine even when they were undergoing trials. In other words, they bought vaccine on risk. So at that stage, of course, we didn't really know, did the vaccines, how effective were they? It turns out that, of course, they are very effective. But they've already pre-purchased, they've already put down the money, already purchased the vaccines, even before the coming off the conveyor belt, even before the coming off the production line. So the middle-income countries or high-middle-income countries like South Africa, we, of course, have committed to the COVAX. And now we, of course, also negotiating directly with the manufacturers once we know the vaccines do work. But obviously, the high-income countries have already purchased even before the results of the trials are known. That's why we are a little bit behind.
Do we know which vaccine we're likely to get?
That really is a subject of first of all, negotiating with the manufacturers for supply, and also our evaluation of the vaccines themselves, looking at various things, the efficacy, the safety, and the suitability for the country. So that is an ongoing evaluation of the vaccines itself.
There seems to be a lot of vaccine hesitancy in South Africa, and you only have to look at social media to see the level of palpable skepticism. Has our government communicated enough around the procurement and the safety of the vaccine to ensure that when it's available here, that we have people lining up to say, I want the jab?
Yeah, you made a very good point, Annie, and I think to answer your question, no. I don't think we as healthcare workers, experts, I don't think the government, that we have done enough to reassure the public on the safety of the vaccines. There is vaccine hesitancy, as you said. In fact, there was a poll, an Ipsos poll, which is a poll done by the World Economic Forum, where they polled South Africans, and up to a third were actually hesitant. They weren't sure whether they would get the vaccine because they were nervous about the safety. And I think we do need to assure the public that the vaccines have undergone a very rigorous, a very thorough evaluation and monitoring of their safety, right from the trial stage, the phase 1, phase 2, phase 3 trials, then the application for licensing to the local, what you call SAPRA, the Health Products Regulatory Authority, and then afterwards as well, there's a post-marketing surveillance. So at each stage, there's a very rigorous monitoring of the safety. And it's a very kind of comprehensive, and modern vaccines are very, very safe. They have to be, because vaccines are given to healthy people, unlike medicines which are given to sick people. Vaccines are given to healthy people, and we have to make absolutely sure that vaccines are as safe as possible. So yeah, the first vaccines that I can get, I will go into my arm for sure.
We're expecting to have another family meeting with President Cyril Ramaphosa. We know the National Coronavirus Command Council is currently meeting. Do you think it's necessary for us to go into stricter lockdown levels to ensure that we curb the spread of the virus until the vaccine arrives?
Yeah, I think, Anlie, you're right. I think that we do need to do something. We are in the midst of a very severe second wave. In fact, we're actually in even a slightly higher risk than even when we started the first lockdown, the first wave. So, but on the other hand, of course, we do know the economic cost and the other health costs as well. We mustn't forget that. So that all has to be weighed up. And it is a very tight balance which the authorities will have to make when they make a recommendation. I do think that we do need more restrictions. Whether it can be as far as a hard lockdown, I would think not, because of the prohibitive costs of that. But these are also, of course, my own personal opinion. I'm not speaking on behalf of anybody. These are purely personal opinion, that we do need extra restrictions, but not a hard lockdown.
Well, thank you for sharing your expertise with us. That was Professor Barry Schoub, Chairman of the Ministerial Advisory Committee on COVID-19.